This is becoming more and more evident in recent news, and it is literally the menopause and menopause makeover.
We're living longer, and interesting part is I said it to John today. I said, menopause, that's like at 50. Mm-hmm. So it's not like people are, you don't have to be 85 years old. Yeah, I know. I'm in menopause. No, but it's interesting because you think about it and it's become a term now, but we've been doing this for years.
Yep.
We've been doing makeovers on people that have kids that are in high school or in college. And now they're like, what about me? My body's changing. Right?
You know, the interesting part is I think we're seeing an upwards trend in certain procedures that are starting younger and younger. And we're honing in our skills. We're increasing the potential of our results just because, you know, it's not that technology is getting better. It's that we're pushing the envelope. And
Absolutely.
So I thought that today maybe you started going over menopause makeover because you do so much of it.
So much of it. And there are times when we used to talk about the grandmommy makeover. Mm-hmm. And you don't have to be a grandmom to be in menopause. And it's very common. So here's what, just in a nutshell, what happens in menopause that is causing this big kind of rush for makeovers now. And why are we doing this so much? It's because the body changes. Mm-hmm. And the reason it changes is because the two big female hormones, progesterone and estrogen, start going down. Right. And not only do you feel differently with your hot flashes, and there's a lot that goes on that we don't help with the makeover, but your body starts changing. And here are the changes. Your skin and mucous membranes become a lot more drier. You don't have that moisture. Having sex for someone that's in menopause sometimes becomes painful. You have to use lubricants, even though we don't do labiaplasties, but that's something that comes into effect there. That's the first thing. The second thing is fat deposition changes. And I hear this on a weekly basis, probably about 10 or 15 times. I work out, I eat right, but I'm still getting fat in areas that I never did. Mm. Breasts start growing again sometimes. And people are like, oh my God, I had a breast reduction. Now I'm 55 and I need to get another one. And these are all things that happen because of these circulating hormones that change. And that's where we come in to say, hey, listen, hold on. You don't have to feel bad about the fact that you're in menopause. And sometimes diet and exercise doesn't help. Now, hormone replacement can help to a degree. Mm-hmm. Some people aren't candidates for hormone replacement due to medical conditions that they have. So where do we come in? And I think that's where it comes down to the menopause makeover, which is really breast and body more than anything. So arms start getting a little fatter. Thighs start getting a little more fat deposition. And the interesting part about all this is I did a little deep dive and I just was looking at some stuff. The NIH did a scientific paper on this, and they actually said the best way to treat some of this stuff along with your favorite plastic surgeon is to use some of these GLT agonists like Ozempic. What I noticed the most lately has been breast lifts, because skin is losing its elasticity as we age, and due to the fact it's drier and it has a little more fullness, it's dropping. So breast lifts or breast reductions, very common.
And correct me if I'm wrong, but with some of these things, you have to alter your plan because we know that after age 18, you lose 1% per year of collagen. But it's often reported that once you hit menopause, that you can lose as much as 30% of your collagen
100%.
In a matter of 2 years or 5 years. And so the idea is, you know, how many times does a patient come to us and they say, I did not look like this 6 months ago. And they're right. They're right. Because 6 months prior, they can show me a photo. And I'll say, I believe you. Because you've lost those targets, the estrogen especially and progesterone for the skin. When you increase your transepidermal water loss, it's that thin, flaky, crepey skin.
Absolutely. How
many times do they come to me and say, oh my gosh, my neck was not like this 6 months ago, and it's so frustrating.
All the time. And here's the thing.
So it's not like at this point you just, flip in subfascial breast aug.
No, not at all.
You're reworking your plan based off of the skin envelope.
And also, the other thing which you brought up is we can give collagen supplementation. We can give dermal repair to them. We can give all of these things to help because I do think they help. I really do. And I think there's no downside to it. So I do think that supplementing with some of these supplements that we have that help with hair, skin, and nails really do help. But ultimately, I think it's going to be a combination of surgical, because sometimes just removing the fat really, really helps, or removing the extra skin from having multiple babies. And you'd be surprised. Sometimes by getting rid of that fat and then adding a Ozempic or a Mounjaro just to maintain it is the perfect combination. And I wouldn't have said this, I tell you not, if I didn't read it the other night, because these medications.
Ozempic is the new Windex and duct tape for.
It's really, but it's great because it can maintain your results even if your hormones are really out of whack. Because some people will do this, they'll come back and be really frustrated because you did all this for me and I still have extra fat on my back. But if you can lose some of the weight and maintain it, then I think that would be the absolute combo that works. Now,
which is surprising because Ozempic face, Ozempic butt, Ozempic, again, it's the rapid deflation leads to saggy appearance. So it is surprising that that's a particular medicine that.
It's funny that you say that though, but it's low dose. So we're not hitting people with the highest dose of Ozempic or Mounjaro. It's going to be the lowest dose just to maintain, just so it curbs the appetite. The other thing is you feel hungrier when you're in menopause. All these things kind of come together because of the fact you have a huge drop in estrogen and progesterone. Now, the interesting part is you see it in the face as well. Now, before I go into that, there's one thing we said, and we talked about this flaky, dry skin. So what do you do? What do you do about that? Because sometimes people come out and they're like, it doesn't matter what I do, I feel like I'm just constantly putting moisturizer on. I feel like my skin is flaking off.
For that period of time, sometimes what I recommend is even for patients to put a body lotion on their face. You're not going to have an acne breakout. That's why you don't use it now, because it's thick, right? But if you have very dry, brittle skin that's very crepey, we want to put something that's thicker on there because we need to trap in as much moisture as possible. We don't want any further loss of, what happens is if you look under a microscope, all of the cells that when you're young, you have a particular peptide called L22. Essentially, these are intercellular junctions that hold the cell together. And that's why when you swim in water, it's a repellent, right?
Absolutely.
So your kid comes out of the water and you see that turgor to the skin,
right,
and the water just flakes off. You're older and you're going to notice a pruning of the fingers and toes and everything like that a lot faster. And so I recommend, now that you've got those gaps, put something that's going to have a protective barrier. And so that's when we start using, at least for a particular time, even if it's twice a week or 3 times a week, you're going to lather a body type of lotion onto your face, because especially at night.
And you may need to do it a little more frequently too. I think that's a good way to do it. Now, the reason, again, we're talking about this is because it's all over the place. I mean, you brought up Oprah, and I just kind of brought this up. And this came up on the cover of Oprah's Daily, okay? It said the Menopause Makeover for when aging gracefully gets old. And it says, because literally everything from eyelids to neck skin to boobs to butt falls off a cliff. Here's a dozen intervention women in this life stage are embracing. And it's interesting because now you can't take care of these things without the intervention of a surgeon. And that's why it's become so big, because people want to look good for their kids' weddings. People want to look good for their grandkids' weddings and celebrations. And when they look in the mirror, it's kind of what you said. They're like, oh my God, what just happened to me? Because there wasn't a major life event, but there was.
Yeah.
And it was menopause.
Yeah, I think if you can do a couple of different things to maintain skin, one is going to be microneedling. I mean, to me, I think anytime you have punctate trauma to the skin, stimulating collagen, it's always a good thing. Again, each year that goes by, you lose another % of collagen. And so the goal is to try to hang on to as much as you possibly can. How often should you do it? Listen, if money's no object, you do it every 6 weeks. If you are trying to think of, key times to do it, I would try doing it at least twice a year. Second thing is, believe it or not, something that's really, really easy. I know you've been using the same makeup for the last 30 years, but you may have to change because skin quality changes. And that's one of the times when you head over to a department store where you normally get your stuff and you ask and say, look, I need a little help from one of the makeup artists. I'm going through these changes. What would you recommend? And I guarantee that they're going to change some of the items that you normally get. When you're younger and we're trying to block oily skin, you use more of a powder base, things like that to help, give you less of a dewy look. But when you're older, you need that dew. And so
true.
The idea is it'll help you change. These are just tiny little things that sometimes you might not think about. You can wear the same makeup and after menopause, it can look absolutely awful because some of that powder stuff settles in the cracks of the skin and it's not helping you at all, right? And then the last thing, obviously, for those of you who say, look, I've tried these things, I've tried some of the non-invasive and minimally invasive things, I've got a good skincare routine, I've hit my peak of what I can do currently, and that's when surgery comes into play. The idea is we're kind of tethered by some ligaments, in the central part of the face. So between the eyes, at the base of the nose, down by the sides of the chin, and the face kind of ages and rotates around it, almost like a Christmas tree fashion that falls after you've got some, heavy ornaments on there. And so imagine a deflated sumo suit, how it falls, and it kind of rotates down towards the midline. And the only way is either to reinflate, which there's a point at which it looks good and then it starts looking, like a Beverly Hills housewife sometimes. Mm-hmm. And the second is you have to remove some of that skin. And so again, and I'm sure you see that same thing for the body.
Mm-hmm. And it's interesting. What do you think the most common procedure is during this period? Because it's gone up so much. And I'm saying this because there was also a cover article on Vogue, May edition, this year that says, forget the mommy makeover. It's time for the menopause makeover.
Ooh, so this is ahead of print.
It's everywhere. And this is like, it is like the biggest buzzword.
You heard it here first, folks.
Interesting part is upper eyelid surgery, blepharoplasty, just to take a little bit of skin is the most common procedure. And it's up year after year by 10 to 15%.
Believe it or not, I don't want to downplay it because it's surgery, but it's one of the easiest surgeries that there is. Imagine it's like taking a mole off. You're just removing some skin. And this, I'm talking about a simple blepharoplasty. This is not revisional or if you require a brow lift or something like that in between, because many times you do. The idea is the brow is so heavy that it makes the folds of the upper eyelid accentuated. But just to remove some of that excess skin, every single patient says the same thing. Not only do you look better, you feel less tired because you're constantly fighting against a heavier brow that's, weighing on your upper eyelid or that excess upper eyelid skin. So it really is. You can even do it on a local anesthesia.
Absolutely.
It's one of those things.
That's probably the most common, but most people that get upper eyelid surgery also get facelift surgery. And I personally think, even though I don't do facial, surgery at all pretty much, I think earlier is better when it comes to a facelift. And again, it's one of those things when we talk about menopause, most people think it's a 75-year-old woman, but it really isn't. It's a 50-year-old. And now there's a new term called perimenopause, where you're circling that time around right before you're going to menopause. So I think most other plastic surgeons that do a ton of facelifts like yourself, I think it's better to do it early.
Yeah. Listen, we see that trend happening more and more where it's younger and younger are coming in. I mean, you've seen some surgeons post 35-year-olds, that
I think that's overkill. But
I think that's a little too much. But let's say the original average age was closer to 60 or early 60s. Now we're getting closer to, early 50s or right around the 50 mark. And so, look, there are two benefits of doing it earlier. We're living longer and longer. So you get to enjoy it more. The second is you're never going to have as much collagen as you have right then, right? Because we keep losing it and it keeps getting worse. So it's almost better to hit it in that perimenopause region where we have the collagen to last than it is to wait till afterwards, because The pull, it needs to be stronger. It may not last as long. And I don't want to show any stigma of having a lift. We want it to just look refreshed.
It's kind of like when we talk about, if you go in and you don't have to make a huge change, it's a lot easier to get away with it and no one will know you had anything done. And it's interesting because similarly, the body stuff falls into that same category in the sense that I have a lot of people that come to see me and they say, I haven't really had a chance to diet and exercise, but yet you can see there's visible post-pregnancy changes. Mm-hmm. I want to stress this fact. And as much as I am a true believer in diet and exercise, and I push it on all our patients, if there's extra skin, if there's a big diastasis, a tummy tuck is needed. There's no way to fix it. I would love to say there is. We just operated on a really good friend of ours last week who we did a mommy makeover on. She's been saying this to me for the past 10 years. Don't worry, I'm going to get in shape. And she's in shape. She looks amazing. But that extra skin, and now she's in menopause. Yeah. And she's like, I really can't get it to get better because it's harder to tone and strengthen and get yourself to where you were 10 years before that. So
now, the interesting part, obviously health and wellness is really important to us. Mm-hmm. And I've read just about every article and listened to every single podcast there is on health, wellness, and longevity. And, obviously we've heard about the caloric restrictions, the intermittent fasting, the 3-day fast, the sauna,
the water fast,
the cold plunges, and all these things. And every single quote unquote longevity expert always goes back to the same thing. There's never been, and this is through multiple scientific studies, there's never been anything more powerful than exercise. And
for sure.
That is lifting weights, that type of exercise. We need that for bone density. We need it for muscle mass. So let's just put that aside, knowing that should be a priority in everyone's life.
Without a doubt.
If you truly want to look and feel better. But if you can't go as often as you would like, we have some alternatives.
And again, guys, I don't think that you do this instead of the other. You still are going to have to do it. But the interesting part is some of the fat and some of the skin just can't be fixed without having some sort of surgical intervention to make it better. Now, I'm just curious, what do we do for menopause?
Menopause, is so funny. The first time I heard that term, I laughed. But the funny part is we also have a shift in hormones. It may not be as abrupt, and ours starts much earlier, right? Our peak is at 18, 19, and it slowly wanes from there. And you lose a significant percent by the time you're 50. So although a female may lose, again, they'll have a large drop in estrogen and progesterone at or around age 50, males have had this slow decline for decades.
The whole low T theory.
Of course. And so, I'm sure our diets and processed and whatever else in the chemicals that we ingest and things like that have played a role over the course of, the last century. But menopause is something real too. Now, the interesting part is that, especially for the face and really the body as well, men have 40% thicker skin. We have hair-bearing skin. The follicle itself causes a thickness in that particular layer. And we constantly shave, and the idea is that it's an exfoliation on a daily basis. So we're kind of taking off some of those dusty layers. So the combination of those two things, often, you've heard the phrase, they age like fine wine. Listen, I'll say there's a difference between aging like fine wine and having the wine spoil. And so I think what we're seeing more and more now that cosmetics, aesthetics is more prevalent in society and acceptable for males, there used to be such a stigma around it. And now we're saying, wait a second, if our counterparts can look so much younger, why can't we? So when we talk about the menopause, I think the same thing applies. I mean, the idea is one of the easiest fixes would be eyelid surgery. And so that's upper or lower eyelids, where we see the puffiness of the lower eyelids, we see the excess upper eyelid skin. And the idea is that's what everybody sees first. Then we start moving our way down. And so the idea is necks and gynecomastia surgery, where we reduce the size of the chest or man boobs or whatever else you want to call it, and liposuction of the abdomen. I mean, we gain weight in certain areas. It's hard. Love handles for males and saddled eggs for females. Those are areas that are commonly, it's a different type of fat, a more fibrous fat that is very difficult to get rid of. And even with diet and exercise, sometimes you can be rail thin and still have those pockets right there. And so that's where surgery comes into play.
And we forgot one big thing, hair loss.
Oh, man.
Now, it does happen earlier too, but as we get older, I think that a lot more people really kind of look at themselves and say, oh, man, I just look so much older because I've lost my hair.
Yeah, listen, one of our previous podcasts with Dr. Adil Khan, he talked about some of the exciting things happening in the future, with stem cell regenerative medicine therapy. But for now, PRP injections, exosome injections, and hair transplant, single follicular unit hair transplantation can really rejuvenate and take years off.
And more people are doing it. And more people are doing it because it's so easy. And it's one of those things that nobody knows you did.
Yep.
In the sense that it's not like before where it leaves a big scar on the back of your head. And I think that's one of those big rejuvenating kind of treatments that men can do that can really make them look significantly younger. And also I've noticed something on myself that's over the last maybe year or two, I never had before. And those are sunspots. And it's interesting because your body has this mechanism of repairing itself and healing itself. When you're young, and you can remember, when you're young and you scrape your knee, it gets better quick. As you get older, it takes a lot longer for it to get better. I've noticed this with sunspots. I used to sit in the sun. I never have sunspots.
Yep.
Now I look at my hands, I look at my face, it's significantly different. So these are all little tiny interventions. An IPL can take care of it. A pico laser can take care of it.
Resetting your skin a little bit.
Even a peel can take care of it. Just really resetting it. And obviously avoidance is the best way, just sunscreen. But if you can, these are all ways to just kind of reset yourself to years prior to where you are right now.
Yeah, and I go back to microneedling. I think that that's for males and females. Anything to stimulate collagen production is always a great thing. And retinols, increase that cellular turnover. That will help with some of the dark spots.
Absolutely.
And use a body retinol as well. I mean, listen, your body suffers too. We have a total body retinol oil that we like, but you can use whichever product that you find out there. The idea is you want to increase that cellular turnover. So, and what I comment on, especially with our practice, which is very unique, the two of us operating together, both for menopause makeovers and menopause makeovers, the interesting part is we've been seeing a lot more where we are co-surgeons, where
Absolutely.
I'll do face, you do body, all at the same time because people don't want that downtime. And it's one refresher. And because there's two surgeons, we get in and out faster. Obviously, within reason, we don't want to create anything that's going to be detrimental to your health or dangerous by any means. But the idea is a lot of what we do is kind of shifting skin around. Soft tissue. It's not like we're doing intra-abdominal or cardiac surgery or brain surgery. This is, we're shifting some of the skin around so you can tolerate a little bit more. In any case, I just thought, it's interesting to bring that up.
Facelift tummy tuck combo has been done by us, I don't know how many times. And I think it's great because people say, hey, I want to have another operation and I want to do it and I want to feel good about the way I look. And I think doing that and then regular upkeep with a med spa of your choice or wherever you go for microneedling and possibly Morpheus and doing little things to really have you gracefully age, I think is okay nowadays. And sometimes, unfortunately, you're going to need the help of someone to help you kind of get over that little bit of a hump for menopause or menopause. And nowadays it's commonplace.
This is where I may even recommend, I've been reading more and more on combination MDs and functional med. You want to find a doc that does some integrated medicine because I do think it's extremely important. We're going up a ladder here. So I think that everyone, as you approach perimenopause, menopause, or for men, and we're in our 40s and 50s, you should probably be taking certain supplementation, depending on what your physician says.
Sure.
But one thing we look at is mitochondrial dysfunction, and that's where, NR, NAD, NMN, things like that help The second,
Yeah, we love that True Niagen. It works well.
yeah,
I
and
took
we have
one
no
this morning.
interest. You know, again, we have no financial interest in the company. We're just, I find that it's a great product for myself. The second, we actually, it's part of our line, but you can choose any product out there that's going to be a DHT blocker. So dihydrotestosterone, aging hormone, we want to block it. So as you age, we want less DHT and we want to keep it into the DHEA, which is a healthier hormone. Then I would move towards microneedling. I should say, before we get to skin penetration, I definitely want retinol. The fourth thing, I would say, that's where we move into microneedling. And then the last thing, that's when we talk about is, surgery. And so you follow that ladder. Some people jump to the last one, but we still recommend the first couple.
Absolutely. Lifestyle modification is as important as anything, and maintaining it throughout. And that's what we tell people. I mean, there are people that come in the office that have mommy makeovers, and they're like, 2 years later, they walk in with this grim face. I gained weight. Well, you got to maintain it. We're here to help you. And if you don't maintain it, just like having anything nice, if you don't take care of it, it's going to fall apart, right?
Yeah.
So I think it's on you as well. And I do think this term menopause has been this term that really kind of is a bad trigger word for people. And it's understandable because hormone shifts are very hard to deal with, especially when you're not used to how to deal with it. So number one, go to your gynecologist, have them look into possible hormone replacement. But when it comes to the effects on your body from menopause or menopause, we're here to help. More amazing videos just like this one. Watch. The one thing that most OBs will tell their patients is, you don't have to overeat because you're pregnant. You don't have to put on a significant amount of weight. 20 to 30 pounds, I guess, is plenty. Some people come in here and they say they gained 80 pounds in their pregnancy. Well, obviously, it's going to change your body. It's going to make a huge difference.